Welcome back to the deep dive. Today we're tackling a really big one. Healthcare accreditation.
Yeah, it sounds maybe a bit, dry,
Yeah,
bureaucratic.
exactly. But honestly, it's so much more than that. It's
Yeah.
not just some badge you hang on the wall.
Not at all. It's really fundamental to how care gets delivered these days.
Right. It shapes everything, managing risk, how you engage with patients, meeting all those regulations and what the community expects. It's genuinely strategic now.
Definitely.
So our mission today is basically to pull back the curtain, demystify this whole thing, give you a solid guide, the concepts, benefits, what's required.
And crucially, how you fit in, because everyone does.
Everyone. So yeah, this deep dive is absolutely for you. Whether you're a doctor, nurse, dentist, pharmacist, tech, admin, anyone in healthcare.
hmm We've sifted through the Healthcare Accreditation from A to Z guide for professionals to pull out the really key stuff, the surprising bits even.
Think of it as a shortcut, getting you up to speed without, having to read a massive textbook.
Exactly. No overwhelm intended.
Okay, so let's unpack this then. We'll start with what accreditation actually is.
The basics, yeah.
Then look at the benefits, the sort of core pieces.
The building blocks.
Yeah, the building block's a good one. And maybe most importantly, what you actually do day to day that makes it all happen.
Sounds like a plan.
All right, so first things first. What is healthcare accreditation? Like, at its core, people say it's an external review.
It is, yeah. An external independent review process. Its main job is checking if a healthcare place meets set standards for quality and safety.
Okay, sounds straightforward enough. But you hinted it's deeper than just, like, a checklist.
Oh, absolutely.
Yeah.
That definition is right, but the fascinating part isn't just ticking boxes for an audit.
Right.
It's about embedding a culture where you're always trying to improve, constantly asking, are we doing the absolute best we can, not just, are we doing enough?
Ah, okay. That's a big difference.
Huge. That's where the real change comes from. And these standards, they come from national or international bodies, reflecting best practices in, well, everything. Patient care, governance, infection control, safety, leadership, the works.
You mentioned some examples, NHRA and Bahrain, then globally like JCI, CBAHI, GAHAR, ISQA. Is there like a different flavor to them, a different emphasis?
There can be, yeah. So NHRA and Bahrain being the national authority, they're really focused on making sure places comply with local laws, local health priorities, tailored standards, you could say.
Gotcha. Local needs.
Exactly. Whereas JCI, Joint Commission International, that's known globally, really rigorous standards aiming for like the top international benchmarks.
So more of a global gold standard.
Kind of, yeah. They all want quality and safety, but the scope can differ. International ones are often about that global reputation, that extra seal of excellence.
Makes total sense. Okay, so we know what it is, why these bodies exist. Let's talk impact. What does this actually mean for you, the professional on the ground? What are the direct benefits?
All right, this is where it gets really practical for everyone listening. The benefits for you, they're significant.
Okay.
Obviously, improved patient outcomes, that's number one, driven by using evidence-based care, solid safety protocols.
Which is what it's all about, really.
But a surprising benefit, I find, isn't just the outside approval, it's the unity inside.
Unity. How so?
Well, when everyone, surgeon, nurse, admin, everyone understands their part in accreditation, it stops feeling like a chore for management.
It becomes a shared thing.
Exactly. A shared mission.
Yeah.
It also empowers you professionally. Clear roles, defined competencies, clinical pathways, so you know what to do.
Less ambiguity.
Much less. Plus, there's a big focus on continuous learning, managing risks better, and honestly, it often leads to better job satisfaction.
Really? Why is that?
Because you're working somewhere that's organized, safe, ethical, it just feels better. It changes the whole vibe of the daily work.
I really like that idea of a shared mission.
Yeah.
Changes the whole perspective. Okay, so if it's aiming for these big goals, it must have some foundations. What are the core components, the building blocks you mentioned?
Exactly. Most systems are built on similar core domains. Think patient-centered care, that's huge, obviously.
They're the absolute center.
Then you've got infection prevention and control, crucial. Clinical governance, how things are run clinically. Human resource management, making sure staff are competent and supported.
Right.
Facility safety and risk management, information management, especially medical records, ethics, rights, responsibilities, and the big one, performance measurement and quality improvement.
Wow, that's quite a list. Of those, which one do places typically struggle with the most, like getting it truly embedded, not just written down?
Good question. They're all vital, but I'd probably say consistently embedding performance measurement and quality improvement
Why that one specifically?
because it demands a real shift, moving from just fixing problems when they pop up
Right.
to being proactive, using data constantly to get better. It's not just about gathering numbers, it's about acting on them, involving everyone and figuring out what they mean.
And that can be tough.
It can mean facing some uncomfortable truths about how things are currently done. That takes real commitment. That's where the heavy lifting often is.
Yeah, that definitely sounds more like a cultural change than just following a rule, which underlines your point. This isn't just for managers.
Not even close. It is absolutely a team-wide commitment. Every single person counts.
So how does that look day to day? Like for different roles, give us some examples.
Sure, take doctors. They might be leading clinical audits, championing evidence-based practices, maybe mentoring junior staff on quality standards. They're often the clinical leaders for this.
Okay.
Nurses. They're right there at the bedside, implementing safety rules, watching patients closely, documenting everything super accurately, teaching families. They are the direct link to safety in so many ways.
Critical role.
Hugely. Pharmacists, vital for medication safety, managing stock, ensuring prescriptions are right. It's complex stuff, easily overlooked, but so important.
Definitely.
Technicians, making sure their equipment is calibrated perfectly, following safety standards for diagnostics or treatments. Accuracy there is paramount.
And the admin teams.
Absolutely essential. Keeping records up to date, coordinating things like patient feedback surveys, managing all the data that flows through. They're the backbone holding it together.
It really does sound like an orchestra, as you said. Everyone needs to play their part correctly.
Precisely. If one section is off, the whole piece suffers.
And to keep that orchestra in tune, I guess education and training must be pretty central.
Oh, completely central. Continuous education is the heartbeat of accreditation. It's not a one-and-done thing.
Right.
Healthcare pros have to do their mandatory CME or CPD hours, get oriented on new policies or procedures, practice emergency drills, fire, code blue, evacuations.
For practical stuff.
Yeah, and undergo regular competency checks. It's this constant cycle of learning, updating, making sure skills are sharp, not just to meet standards, but to keep up with new knowledge and tech.
Staying current.
Exactly. It's about continuous readiness.
Okay, so with all that understanding, what's the actual journey like? Getting accredited, it can seem like this huge, daunting mountain to climb.
It is a structured path, yeah, but maybe less mysterious than it seems. It usually kicks off with a gap analysis.
Okay, figuring out where the problems are.
Basically, yeah. Seeing where you are versus where the standards say you need to be. Then comes developing or refining policies and procedures, SOPs.
Getting the rules written down.
Right. Then, crucially, staff training on those new or updated ways of working. After that, you typically do an internal audit.
A practice run.
Sort of, yeah. Checking your own readiness. That usually highlights some things, leading to corrective action planning, fixing what you found.
Makes sense.
Then often a mock survey, like a dress rehearsal with external eyes, perhaps, before the big one, the official accreditation visit.
The main event.
And it doesn't stop there. Afterwards, there are usually post-audit improvements, sustaining the changes, continuing to improve.
So 8 steps. Gap analysis, policy development, training, internal audit, corrections, mock survey, official visit, post-audit improvements. Sounds linear, but is it?
Good point. It sounds linear, but the reality, it's often iterative. You might do a gap analysis, develop policies, train staff, do an internal audit, and find you need to go back and tweak policies or do more training.
So back and forth is normal.
Very normal, especially between the analysis, policy, and corrective action stages. That's where, like you said, the real deep work happens, turning paper into actual practice.
That iterative part is key, I think, not just a straight line. Now, you mentioned earlier the difference between global and national bodies. Can we circle back to that? Why would a hospital choose one or the other, or maybe even both?
Sure. The distinction's pretty important for strategy. Global bodies like JCI, Accreditation Canada, they offer international recognition, benchmarking against the world's best, essentially.
So it's about reputation, attracting international patients.
So that's often a big part of it, yeah. Signaling you meet world-class standards. National authorities, though NHRA in Bahrain, GAHAR in Egypt, CBAHI in Saudi, they're about ensuring you meet local laws and health priorities.
So national is usually mandatory.
Generally, yes.
Yeah.
It's often the legal baseline you have to meet to operate. International accreditation, that's usually voluntary.
No choice.
A strategic choice, yeah. It enhances that global reputation, builds trust, especially if you're aiming for a higher tier of recognition or competing in a bigger market.
Okay, so baseline compliance versus strategic excellence. Got it. Now, with all this talk of processes, standards, audits, where do the patients and their families fit in all this? It feels like they should be central.
They absolutely are, or at least they should be. Accreditation isn't just internal navel-gazing.
Right.
It's critically about engaging patients as real partners in their care.
What does that look like in practice?
It means things like really transparent communication, making sure informed consent is truly informed, respecting patient rights, their privacy, and importantly, making it easy and safe for them to give feedback or even complain.
So, listening to the patient voice.
Actively encouraging it. And those patient satisfaction scores, the patient experience surveys, they aren't just numbers on a report. They are vital indicators for accreditation.
Proof of patient-centeredness.
Exactly. Direct evidence of whether the organization is actually living up to those promises from the patient's own perspective. It validates the whole effort.
Okay, so it touches everyone, processes, staff, patients. What does this mean for how an organization needs to be structured or aligned? Who really drives this?
Well, this leads to a really fundamental point. Accreditation is genuinely a joint responsibility. It can't just sit with one department.
Not just the quality department's job.
Definitely not. It absolutely has to be led by leadership. Their vision, their commitment, the resources they provide that sets the whole tone.
Top-down support is crucial.
Essential. But then it needs to be owned by the clinicians. The doctors, the nurses, the people delivering the care. They have to believe in it and practice it.
Okay, led by leadership, owned by clinicians.
Enabled by administrators. They
Yeah.
provide the systems, the tech, the support structures needed.
The infrastructure.
Right. And then it needs to be monitored by the quality teams. They keep an eye on things, track progress, help identify where improvements are needed.
So it's this interplay between all these groups.
Exactly. Everyone needs to be pulling in the same direction, aligned with that vision of excellence. If one part isn't engaged, the whole system is weaker. It's truly about collective accountability.
Collective accountability, I like that.
And, if we zoom out to the biggest picture, the ultimate goal here isn't just getting that certificate for the wall.
It's more than the piece of paper.
So much more. It's about building and sustaining a deeply ingrained culture of safety, of accountability, and ultimately striving for zero harm.
Zero harm, that's a powerful goal.
It is. Accreditation pushes organizations towards that mindset of continuous improvement, where systems get reviewed constantly, performance is measured honestly, and striving for excellence just becomes, well, the way things are done.
Norm.
The norm, a proactive living philosophy, not just a hoop you jump through every few years.
Wow. Okay, so wrapping this up, what's the main takeaway for everyone listening?
I think.
What does it all mean for you? Because whether you're that senior doctor or the nurse just starting out, the experienced tech or the person managing appointments, your role in accreditation genuinely matters.
He really does.
Understanding it, applying these principles, it's not just helping your hospital or clinic succeed on paper, it's about safeguarding actual lives, elevating the care everyone receives.
Absolutely. So maybe the final thought is this. Don't just see accreditation as an inspection you have to pass.
Okay.
Try to make its principles, safety, quality, continuous improvement, teamwork. Make that your professional philosophy. Let it shape how you approach your work every single day.
Let it be more than an inspection. Make it your professional philosophy. That's a great place to leave it. Powerful stuff.